Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for pathology videos. Today in this video we will discuss topic syphilis, which comes under infectious diseases. Syphilis, it is a spirochete by name Treponema pallidum, and the syphilis is characterized by three sequential clinical symptomatic stages that are separated by periods of asymptomatic latent infections. Treponema pallidum is a thin, delicate, helically coiled or corkscrew-shaped 10 to 14 microns long and zero point 0.1 to zero point 0.2 microns wide, actively motile organism. And the risk factors for syphilis are unprotected sex, multiple sexual partners, HIV patients, and unborn babies of mothers with syphilis infection. Coming to the etiology, the bacterium Treponema pallidum is the causative organism and it is transmitted by sexually or through contact with the infected lesions, blood transfusions from the infected patients, and also from the infected mothers to the babies. Coming to the pathogenesis of syphilis, Treponema pallidum is transmitted by various routes, and the growth of the organism will occur at the site of the infection. Then there will be dissemination to the various tissues, and there will be a stage called as primary syphilis, in which there will be canker formation and regional lymphadenopathy. Later, it may goes into a stage called as secondary syphilis, where there will be a disseminated rash and generalized lymphadenopathy. And after the secondary syphilis, there will be a latent syphilis where there are no symptoms. Microbes will distribute all over the body in this stage. Then tertiary syphilis, the infection will spread to brain, heart, eyes, bones and joints, and this will lead to multi-organ damage. So in the pathogenesis, what is happening actually? The proliferative endarteritis affecting the small blood vessels will be the first step. Then there will be ischemia because of the lack of oxygen supply blood. There will be Th1 response. Because of this Th1 response, there will be secretion of interferon gammas or release of the interferon gammas, which will activate the macrophages and helps in killing the bacteria by phagocytosis. The treponema specific antibodies will activate the complement, and there will be opsonization of the bacteria by these macrophages. Treponema pallidum proteins TPRK will be present in the outer membrane of bacteria, which will facilitate the persistence of syphilis infection. Types of syphilis. The syphilis can be described under four headings. One is primary syphilis, the other is secondary syphilis, the third one is latent syphilis, and the last but not the least, it is tertiary syphilis. In the primary syphilis, it will appear after 10 to days of the infection with Treponema pallidum, and there will be one or more small painless sores that will appear in or around the genital regions, anus, and mouth. In secondary syphilis, it will appear after 2 to 8 weeks of the infection, and it will affect mainly circulatory and lymphatic systems. Latent syphilis will appear after 4 to 10 weeks of the infections. This is a asymptomatic phase, so there will be no symptoms. In this phase or stage, the microbes will spread all over the body. In the tertiary syphilis, which will appear after 10 to 30 years of the infection, the brain, heart, eyes, bones, and joints are affected in this stage. Clinical presentation. In primary syphilis, the characteristic feature is canker formation. What is canker? Single firm, non-tender, raised red papillary or papillary lesions on the penis or scrotum in men and on vulva or cervix in women is the characteristic of primary syphilis. Secondary syphilis, there will be a red-brown macular rash involving the palms and soles of the feet, and there is also silvery gray superficial erosions on oral, pharyngeal, and genital mucous membranes. There is a condition called as condyloma lata, in which there are broad-based elevated plaques that are present around the anogenital region and in the regions of inner thighs and axillae. Along with this, there may be malaise, fever, pharyngitis, headaches, anorexia, and arthralgia in secondary syphilis. Latent phase is asymptomatic. In the tertiary syphilis, when the brain is affected, it is neurosyphilis. There will be severe headache, difficulty in coordinating the muscle movements, paralysis, and numbness, and dementia will happen. In ocular syphilis, there will be blurred vision and blindness. In cardiovascular syphilis, there will be syphilitic aortitis. This is a picture showing the clinical presentation of a syphilis. First, there will be inoculation, and the organism spreads by lymphs and blood, and it will enter into a primary syphilis where there is a characteristic canker formation at the site of the inoculation on the penis, labi, or vagina. Then there will be asymptomatic period up to 24 weeks. Then it will be a stage called as secondary syphilis where you can observe a rash accompanied by hepatitis, meningitis, or glomerulonephritis. Then there is a phase, latent phase, where there will be no symptoms and the treponema pallidum will present in the latent state, and it will last for 3 to 30 years, spread to all over the body. This latent syphilis may go back to secondary syphilis in few cases. After the latent syphilis, it will enter into a phase called as tertiary syphilis, where gamma bodies are seen. Gamma bodies are the lesions that occur in the deep organs along with CNS degeneration and ascending aortic aneurysm. Complications of syphilis: neurosyphilis, ocular syphilis, cardiovascular syphilis, congenital syphilis, joint syphilis, or bone syphilis. Syphilitic aortitis can be asked for a 5 marks question or a 3 marks question. So it is the CVS infection by Treponema pallidum and it is seen in tertiary stage. It may be the complication of the syphilis. The ascending aorta will demonstrate a rough and wrinkled intimal surface indicating the aortitis. There may be a dilatation of the ascending aorta and resulting in aneurysmal formation. Congenital syphilis, this can be asked for 5 marks question or a 3 marks question. The cause is maternal, primary or secondary syphilis. Manifestations: intrauterine and perinatal death occurs in untreated cases. This congenital syphilis is further classified into infantile syphilis and tardive syphilis based on the years where it will come. If the congenital syphilis is seen in first 2 years of life, then it is called as infantile syphilis. And if it is seen after first 2 years of life, then it is called as tardive syphilis. In the infantile syphilis, there will be nasal discharge and congestion. There will be bullous eruptions of palms and soles with epidermal sloughing. There may be osteochondritis and periosteitis. resulting in characteristic features of infantile syphilis, that is saddle nose deformity and saber shin deformity. And there may be diffuse fibrosis in liver and diffuse interstitial fibrosis in lung. So for MCQs or in Viva questions, they may ask you saddle nose deformity and saber shin is seen in congenital syphilis. They can be asked like that, or saddle nose deformity and saber shin is seen in first 2 years of life in infantile syphilis. Coming to tardive syphilis, it appears after first 2 years of life. There will be triad of symptoms or signs: interstitial keratitis, Hutchinson's teeth, and eighth cranial nerve deafness. Interstitial keratitis, Hutchinson's teeth, eighth nerve deafness. So this is a picture showing the Hutchinson triad in late syphilis, that is Hutchinson teeth, interstitial keratitis, and sensory neural deafness. And the other picture, first picture showing the early syphilis or infantile syphilis, that is seen in first 2 years of life, with syphilitic rhinitis called as snuffles, and vesicular and bullous eruptions, and hepatosplenomegaly. There may be bilateral dissection of the medial tibial metaphysis and shown by Weinberger's sign. So diagnosis of syphilis can be done with the help of the biopsy using dark field microscopy and also silver stains. Immunofluorescence also plays a key role in diagnosis of syphilis. Serological tests are being suggested for syphilis will be VDRL, Venereal Diseases Research Laboratory Test, and RPR card test, that is rapid plasma reagent card test, and USR test, that is unheated serum reagent test, and TRUST, that is toluidine red unheated serum test, PCR polymerase chain reaction direct fluorescence antibody test for TP, that is treponema pallidum, DFA TP, or TPEIA, treponema pallidum enzyme immunoassay. Treatment for the syphilis will be personal hygiene, counseling, and usage of benzathine penicillin G and doxycycline is very much useful in treatment of syphilis. So in a nutshell, the characteristic lesions or granulometal lesions are gamma bodies consisting of central coagulative necrosis and few immune cells and fibroblasts. And stages of syphilis will be primary, secondary, latent, and tertiary phase. Primary will be within 1 to 3 weeks, secondary will be 6 to 12 weeks, and latent will be early within 1 year or late after 1 year, and tertiary syphilis that will occur after years. It is caused by Treponema pallidum gram-negative spirochete bacteria, and it develops in untreated individuals years and decades after initial infection. And signs and symptoms will be gummatous syphilis, late neurosyphilis, and cardiovascular syphilis. Treatment is with antibiotics, benzathine penicillin G, and doxycycline. Regimens depends on the stage of the syphilis. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting pathology videos.